Good morning. Welcome and thank you for joining us for our Northern Light Health Good Health is Good Business Zoom conference. 1 month ago, I opened our session by sharing that in Maine, we reached the highest new cases per day of people diagnosed with COVID-19 and the highest number of COVID-19 hospitalizations across Maine at 280 people hospitalized, and the highest positivity rate for testing. All of these numbers highest since the pandemic started. Today, I unfortunately report that we've surpassed all these records, most notably a recent new high of 379 people hospitalized with COVID-19 in Maine. These people are very sick due to the Delta variant. The Omicron variant is on the horizon. It has been described this past Monday by Boris Johnson, the Prime Minister of the United Kingdom, as the coming tidal wave. History provides some insight. Will very likely be next. The bottom line today is boosters offer the best countermeasure. Today, our topics will include the latest on COVID-19, living safely with COVID-19, building new habits to support wellness. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Beacon Health. I'll be your moderator for the next hour. Our panelists today are Suzanne Mooreshead, Associate Vice President of Infection Control at Northern Light Health, Yamaya St. Clair, Employee Assistance Program Counselor at Northern Light Workforce, and we extend a congratulations to Yamaya for recently achieving her professional counseling license. Congratulations, Yamaya. Dr. Jim Jarvis, Director of Clinical Education at Northern Light Eastern Maine Medical Center and Physician Leader of the COVID-19 Incident Command at Northern Light Health. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. A reminder, this hour is for you. If at any time you have a question for our panelists, please use the Q&A function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Dr. Jarvis will start us off with the latest on COVID-19. Dr. Jarvis?
Thank you, Dr. Gilkey. Once again, we hold up this slide that kind of shows us where the hot spots are around the nation, and you can see that unfortunately most of the country is in a deep state of red towards that higher end, and certainly we here in Maine are seeing that with, as Dr. Gilkey stated, record high number of cases nearly every single day. Next slide, please. And so this is, again, a look at newly reported cases in the state of Maine. And you can kind of see, we look at December of last year, and we thought that was going to be our huge surge as it went through December and into February. But then since the summertime, we have had this steady climb of new cases across the state, and that really does reflect the Delta variant and how infectious it is. But you can see towards the very, very end there that climb now has become even steeper, and we'll talk a little bit later today about what could be causes for that. New slide. Talking about just the differences between those who are vaccinated and unvaccinated. And you can see that in average daily cases that unvaccinated can be 5 times more than those that are fully vaccinated. And then even more dramatic, when we look at average daily deaths, unvaccinated individuals are 13 times more likely to die than vaccinated individuals if they were infected from COVID-19. Those are stark numbers to see such an incredible difference there. And so it's just another reminder of how important vaccines are in protecting not only ourselves, but our friends, family, and community. Next slide, please. So this is just hammers home again that difference between the vaccinated and the unvaccinated. We're talking about severely ill individuals. Currently 91 individuals hospitalized across Northern Light Health. 68 of those individuals are unvaccinated. Remember that here in the state of Maine, with over 70% of our total population being vaccinated, that is the larger pool of individuals. And so when you see it flipped that the unvaccinated individuals, who represent only 30% of our population, many of whom are children who are not yet eligible, it's a stark reminder that vaccinations do work. If we then look at that in the intensive care unit, you see it even more dramatic. And then again, those that are the most critically ill requiring ventilation, only 2 of those individuals are vaccinated. Down at the lower portion, you can kind of see the age differential and spread, and the majority of individuals who are vaccinated, who are in our hospitals, are older than age 50, with many of them being over the age of 60. And that's probably twofold reason for that. One, more of them have health conditions that may make them more at risk. And also, many of these individuals were vaccinated more than 6 months ago, and we're seeing waning immunity in that particular population. Unfortunately, if you look at the other end of the spectrum, our youngest individuals there are unvaccinated, and we can see that there's almost a spike there of people in the 50 to 60 category who are being hospitalized now, who are unvaccinated, and those are individuals that should not be getting sick at this time. Next slide, please. So now talking about Omicron. So the fact of the matter is we don't know a whole lot about Omicron yet. Most of the data that we know is really coming out of South Africa, where the most cases have been identified so far. But there's some startling things there. If you look at that graphic, looking at South Africa's data, you can see that from the original strain to the beta strain, they had some significant peaks. Then they had a tremendous peak and quick rise from the first time that a case was identified with Delta. Similar to what we saw here in Maine. But then you look at the Omicron, from the day of the first case to almost high numbers as they've seen with Delta, that only happened in 20 days. That is a dramatic increase in the spread of this particular variant compared to what we saw before. So again, if you remember back in June, we started the month of June with about 10% of cases in the state of Maine being Delta, and finished June with over 50% of cases being Delta. If Omicron takes hold here and follows the way it did in South Africa, we're not talking weeks for it to become the dominant strain. We're talking days. You can see there that when we talk about the symptoms, they're very similar symptoms than what we saw with some of the other viruses. The data out of South Africa seems to indicate that it's causing less severe disease, but more cases. And if there's more cases, there will be more hospitalizations, even if it causes less severe disease. But I'll remind people that in South Africa, the average age is much younger than we see here in the United States, and certainly much younger than we see here in the state of Maine. Their population is just a very young population there, and so it will be difficult to compare what they're seeing, and we'll just have to wait and see how things go. The other thing that they're seeing is an increased rate of reinfection, meaning people who had previously had either the original strain or the Delta variant now being infected with Omicron. What they're also seeing, though, is people who have gotten their booster shots are far less likely to get infected. So another plea for that. And next slide. And so this is just basically us saying that we do have availability to get your vaccine, whether that be your initial series or your need for a booster shot. We've just opened up 2 new clinics specifically to aid in Cumberland County and Penobscot County in getting those vaccines out. The one down in Cumberland County is held at the main mall at the old Pier 1 building. That is a walk-in clinic. The last 2 days that they were open, they saw well over 1,000 individuals, and they were happy to provide that service there. In Bangor, it's by appointment only, and that can be reached at covid.northernlighthealth.org. And then you can make an appointment to be seen in that clinic, and they are open for both booster and primary series. I'll also put in a plug that now is the time, if you haven't already received your flu shot, please get that. We are seeing cases of influenza here in Maine, and we don't want to have that double whammy of having to deal with people who are positive for COVID-19 needing hospitalization and people who have influenza needing hospitalization. I believe that is my last slide.
Well, thanks, Dr. Jarvis. Next up, I believe we have a poll. So are your holiday plans going to change because of new COVID variant and rising cases in Maine? Okay, so we'll end the poll, and we have a little bit of a split, yes, no, and maybe. Great, so that's good to give us perspective. Well, next up is Suzanne Mooreshead, who will help us understand how to stay safe during this pandemic. Suzanne?
Hi, thank you, and good morning. Boy, it's really hard to believe that we've been talking about COVID for almost 2 years. Through this time, we've watched COVID kind of ebb and flow, and it certainly looks like we're going to be living with some level of COVID for the foreseeable future. The good news is, in the last 2 years, we've learned a lot with how to live with COVID and how to be able to celebrate and share some special moments with family and friends. So how do you know if it's the right time to get together, and how do you enjoy time with others safely? First, and the most important thing to do is to know your risks. First, who are you going to be with? Are they people that you regularly associate with? You know what their risks are, you're around all the same people? Or are you planning on trying to get together with people you only see occasionally throughout the year? If you see them occasionally, are they generally cautious people? And do you trust that they're following any and all safety measures needed for where they live and work? Those are going to be some really important considerations as you look to see, are you going to be able to get together with them? And just as important as who they are, where do they live? Right now, COVID is on an upswing just about everywhere, but some places are seeing a larger surge than other places. If you're not sure about where you're traveling to, I highly recommend that you visit the CDC COVID data tracking site. This provides up-to-date information on the spread, and it also gives you predictive models on what likely case rates are going to look in the near future. It's really helpful when you're planning your travel. So you decide that the risk of where you're going is acceptable to you, you know who you're visiting. There's some other considerations that you need to think about. And one is, how are you going to get there? And I'll talk about travel in just a moment. Some of the other items to consider are the vaccination status of those that you'll be around and the requirements of the areas that you're traveling to. It is okay to ask people that you're visiting whether or not they're vaccinated, and also simply to ask, are they feeling well? Are they ill today? It's also okay to ask, have you received a booster, and ask, when did they receive their vaccine or boosters? And if you're going to be going to dinner in some parts of the country, proof of vaccine may be mandatory. Make sure you know before you go so that you don't get into, don't show up for an event that you're not able to get to. Private gatherings are generally not always safer than public events. At least with a private gathering, you have an idea of who else will be there and you can gauge your own risk. And then most importantly, in terms of knowing your risk, is knowing your own health risk. Are you at high risk for severe illness because of a chronic condition or your age? Or are there others that are attending that are at high risk? If you're not sure, then just ask. Those are really important things. I would like to say that there's some real easy, simple thing to ask, but there really isn't a great, hard, simple rule to say at what point a risk is too great to go. It's complex, and you have to look at all of these risks to decide what's right for you and those that you're celebrating. So you decide you're going, you're on your way. How do you get there? Private vehicles will always be safer, but they are not risk-free. Make sure if you need to stop for food or fuel, you consider any local laws such as masking requirements so that you're prepared. And always keep some hand sanitizer in your car, as well as a few extra masks in case you need it. Public transportation does have its own set of rules. Right now, masks are required on all modes of public transportation. But honestly, they're needed in places where it's not mandatory. Any place where you're in a high crowded area, you really should consider wearing a mask. These are generally circumstances you have no control over the people around you, and you have no idea where they've been or what they've been exposed to. So you really need to take some extra measures to protect yourself. Make sure, again, you keep hand sanitizer with you. And right now, there is no limit on the amount of hand sanitizer you can bring on an airline. And also having some extra disinfection wipes are always handy as well. Now, if you want to go ahead and move to, so I've talked about masks before, but as a reminder, a mask should fully cover your mouth and your nose without a lot of extra gaps. And while a mask may help keep you safe to some extent, it is always better if both people are wearing a mask. So not only you wearing a mask, but those that you're interacting with around you will keep both of you safe. And keep your distance as much as possible, particularly if you're around people that you're not normally with. If you're doing a large family meal, plan seating into households grouped together, and that will help minimize risks and keep people distant. Again, have hand sanitizer handy. And if you're hosting, have a few extra pumps handy. I've seen some pretty festive ones out there. So just kind of throw them around and they'll be really appreciated by your guests. And you can just place them in places that they're not so obtrusive. And more than anything else, if you are not feeling well, don't go. Staying home and coming up with a makeup plan is always better than giving the gift of COVID. And if you're hosting, let family and friends know it's okay to change plans at the last minute. This is the year to be flexible. And as we've learned, circumstances change quickly. Surges sometimes come out of nowhere and people get sick or have exposures. I recommend ask the really hard questions, decide what's best for your family, and then set some ground rules. For example, my husband's family has an annual Thanksgiving dinner. It's hosted by one of his cousins, but it includes several elderly aunts and uncles with all various health conditions and a couple of college-age kids that come as well. Last year, we canceled it. It just was not safe enough for anyone. Nobody was vaccinated, and the community spread was high, and nobody felt safe or comfortable. This year, we were able to get together again, but my husband's cousin set some really hard ground rules. Everybody had to be vaccinated to attend, and if they were eligible, they also had to have their booster shot. And then all family had to check in the day before on how they were feeling. This resulted in a few not planning on attending at all, and one person canceling at the last minute because they weren't feeling well that morning, but allowed everybody to get together, enjoy the day, and by most importantly, asking those hard questions, nobody got sick, and it ended up being a perfect day. For those that aren't able to be there, make sure that you include them. FaceTime really helps bring people together. And had dinner been canceled, we had backup dates already planned. Compared to where we were a year ago, the questions that were asked and any last minute changes really were only minor issues. In the last 2 years, I have become very selective in what I do with my get-togethers. I look at what risks are acceptable and what I'm willing to do. Because I'm so selective, it's really only the meaningful activities that kind of pass muster, and I enjoy them even more. As you get to evaluate your own plans and decide how you're going to move forward and enjoy life with others and what risks you're able to take, You just may find that the options in front of you are more meaningful than they ever have been. Thank you.
Thanks, Suzanne. You actually reminded me that last year our Christmas did have an alternate plan, and we did the little family gathering in Memorial Day. Had the tree up too. Well, thanks for that. Next up is a poll that we're going to see what people say. My level of stress this holiday season is greater than last year, less than last year, the same as last year. So it looks like we're about even between greater than last year and same as last year, and then some are less than last year. I think you could have a consultative service with a group of us to find out how you got to less. So that's fantastic.
Yeah, thank you. That doesn't particularly surprise me. You know, there's the layers of the holidays and COVID combining, and perhaps a little more pressure to be a little bit more festive this year, and a little more pressure to be a little more social. And yet this wave of COVID is really impacting our ability to connect in the ways that we want. And that's very discouraging for a lot of people. You know, many people experience a foreboding sense of doom and gloom when they think winter is coming. And this winter is particularly discouraging for many who anticipated being free from COVID-related stressors, only to find themselves in this new wave. You know, winter mood shifts, they're often associated with behaviors like hibernation or sleeping too much, and overconsumption, both of food and alcohol, and isolation. Studies suggest that neurotransmitters in the brain are impacted by changes in circadian rhythms in winter as a response to less sunlight. So it's interesting, mood shifts are actually often less about cold weather, though we may experience negative thoughts about the cold, which impacts our mood, and more about lack of light. This really speaks to the importance of getting outside or even sitting in front of a window where light can come through. In addition to light, there are lots of other ways we can manage our mood. One of the best ways is to think about mood management as a river rather than a whirlpool. So stick with me for just a moment. If we think about rivers and whirlpools, right? If we don't allow our mood to move through us like a river and instead try to ignore it and push it aside, it's not going anywhere. It's going to circle back on us and circle back and so on until it feels like we're going in circles and getting nowhere. So we want to make this shift, right, from a whirlpool to a river, and that's about processing our emotions. We have to recognize what's going on in order to allow these emotions to move through us. I invite you to think of someone you know that you would describe as emotionally healthy even during the winter months, and consider some of the things they do to manage their mood. I imagine you'll see some of those things listed here on this bulleted list. And as you're kind of thinking about winter wellness and your own wellness, I invite you each to consider how to best nurture yourself. There is no one right way to do this, right? The key is to be intentional and to shift the mindset to embrace winter. I like to borrow from the Norwegian concept of hygge. I'm sure many of you have heard of this. It's this kind of culture of coziness, getting into favorite soft clothes, piling on blankets, lighting candles, making tea, playing games. For many, the winter months offer an opportunity to slow down and savor each moment. So here you'll see a list of ideas of things to do inside and out that make winter more enjoyable. And I want to go back to that word intentional again. I know you've probably all heard that from me a million times if you've listened to this panel with me on it, but it's super important that we don't just do the same thing again and again and expect different results, right? We have to intentionally shift habits. And that does require some goal setting. And I encourage people to remember to keep their goals SMART, right? We've probably all heard this acronym, and it doesn't hurt to revisit it. SMART stands for specific, measurable, attainable, realistic, and timely. So a goal like, I'm going to be more active this winter is far less effective than a goal like, I'm going to walk outside every weekday from 12 to 12:20 for 1 month, right? It's smart. I also encourage people to find time for fun, right? I recognize there's a lot of heaviness and hardship in the world right now, and we can hold both that and fun. With less light, research indicates our brains may be getting less serotonin, which is one of those feel-good chemicals we need for our wellness. So finding ways to boost your serotonin is especially important in the winter months. I know for me, winter is a time for a lot of outdoor play. I recognize I have all the gear, I know how to layer, and I may have even written a guidebook about winter camping. So I'm definitely on the far end of the embrace winter spectrum, and not everyone is there. I know a lot of people who are, really deeply uncomfortable outdoors in the cold, and that's okay. So for those people, I really invite you to think of other ways you can get more light into your life and invite some fun into the day. I know some who make a point to take a midday game break by a window, getting off screens, sitting by a window, pulling out a deck of cards or a cribbage board. There's just a lot of different ways to find joy as long as we're intentional about it. And lastly, I want to talk about how managers, leaders can model this. We work with some leaders who find the entire concept of self-care to be antithetical to their image of what a serious leader looks like. It may, seem like a indulgence or a luxury they feel they can't afford. And with these people, we help kind of reframe self-care as more of an investment that can increase their overall productivity and effectiveness as a leader. The research really supports this. It's clear that a balanced diet, exercise, sleep, emotional regulation, these things promote health and well-being. And we know without health and well-being, we probably can't achieve what we want to as leaders. So, again, understanding self-care, like everything else, this is as individual as the person practicing it. So really make it your own and make it micro. Short diversions can provide a really powerful boost. Even exchanging 5 minutes of scrolling through social media with 5 minutes of stretching can make a really big difference. And often managers need to make time in their agendas for self-care. For many, I've heard this a lot, if it's not on the calendar, it's not going to happen, right? So put it on the calendar, make it happen. And once you've got it, share it. Once you've figured out your own routines, leaders really set the tone for your people. So share what's worked for you, how you, and then make it clear that both through your words and through your actions that you know the importance of taking care of yourself. And if you're open about your investments in self-care, your team is likely going to follow your lead. So, here at Workforce EAP, we offer a host of services that can help your employees manage their stress, build their resiliency, and hone their professional skills. I invite you to reach out if you're looking for ways to support your team members' wellness this winter. And there are additional resources available through our Northern Light partner organizations that are listed here. And of course, please always know the main crisis line is a resource you should keep handy and post it at your workplace. I think that's it for me for today. Thank you.
Thanks, Yamaya. For this next segment, we will ask our panelists to join on video and to answer your questions. Just a reminder to place your questions in the Q&A box. Okay, we got everybody set up. And I'm going to start off with a couple of questions for you, Dr. Jarvis. Runny nose is listed as a symptom of Omicron. If you have that symptom for one afternoon and nothing else, is that cause for testing? How do you determine if you need a test or not? So difficult to know what is recommended. Should you have multiple symptoms longer than one day? So that's a great question for sure.
Yeah, it's an absolutely great question, and one I don't have a specific answer for, so I'm going to give a vague one, which is it really depends upon the setting. So if you're certainly somebody who is at high risk for disease, I'd have a lower threshold to get tested than if you're otherwise healthy and your symptoms are incredibly mild. One thing I will say, though, is that regardless of what the scenario is for you to stay home until you've determined what is going on, Because what we constantly find is that when we have outbreaks of individuals, it's because one person kind of said, oh, it just felt like a cold, or it was just my allergies, so I thought it was okay to go to that cake decorating party, or I thought it was okay to go to work that day. And then the next thing we know, we have 5, 10, 15, 20 people who are now infected. And so my key here is stay home and figure out what it is that's going on. If the symptoms go away in a few hours, it was probably more allergies than anything else. If the symptoms last, though, certainly testing is indicated. And if you're at high risk for disease, you should get tested as soon as you start having those symptoms. So excellent. Suzanne may have some other advice for people as well.
Yeah, Suzanne, anything else you might want to add?
No, I could, just simply to agree with Dr. Jarvis, don't discount symptoms. That's something that we see all the time where somebody associates a symptom with a chronic illness or allergies, or if it's not something that is consistent, and if it's changed from the way it was the day before, certainly stay away from other people until you're sure of what it is.
Great, thanks, Suzanne. So someone's interested in the EAP resources slide. So Ben or Andy, if you could put in the chat room the access point. I think broadly it's the same access point as what you registered on. How accurate are the Binax home tests? Can we rely on them in lieu of getting swabbed at a swab site? Suzanne, you want to try that one?
Sure. They are not as accurate as a molecular test. In terms of a false negative rate, when there's a lot of community spread, you're more concerned about a false negative. And for somebody who actually has COVID, it will give them a false reading 30% of the time, which is a staggeringly high number. So if somebody is symptomatic, they take a Binax now or any one of the other antigen tests that are out on the market and it's negative, I wouldn't necessarily say, yeah, you're good to go. If you have, your symptoms are persisting, then you really do need to have a molecular test.
Mm-hmm. Okay, great. That's helpful. Jim, this question is actually from me. So I'm thinking through the messaging here, and actually the basis of this is a conversation I had with a cousin of mine recently, whose view of the world is, I probably don't need a booster. Omicron, it causes mild disease, and we've been hearing that in the news. I think you kind of gave us some insight to that when you said the news is coming out of South Africa. These folks are a younger population, less likely to get severely ill to start with. I think some more of the story might be they're about 40% vaccinated in South Africa, but about 50% have already had COVID-19 previously. So to whatever degree there's immunity, and that's defining the mildness. Now, having said that, it's likely that we may see milder disease, but nonetheless, we could see many hospitalizations and unfortunately many deaths in spite of what we're hearing, in terms of the news interpretation of that early data coming out of South Africa. So the other part of it is we're hearing a couple of days ago that about 3% of the tested variants in the US are already Omicron. We're hearing that 13% out of New Jersey and New York are Omicron. So kind of put that whole story together and kind of once again reach into your crystal ball and tell us what you're thinking about all this.
All right, Ed,
That's fantastic.
Really, it's about volume economics. So even if Omicron was to cause, 30% less severe disease than Delta, if it's 50% more infectious, and it seems like it could be even higher than that, you then have more people getting infected. So even if fewer percentage-wise get severely ill, the absolute numbers are still going to be high, and that's where the concern is right now. And the other thing to think about is let's not even talk about severe disease and death. First of all, if you have a way of preventing yourself from getting sick, why don't you take that prevention regardless of the level of the illness? And think about it. We just talked about, even if you have sniffles, you should stay home right now because we don't know what's going on. So imagine if our workforce, everybody starts having sniffles because they're having mild symptoms from Omicron, having to stay home for a period of time. That's just going to, have an unprecedented economic bearing on us. Now let's talk about the more social and personal effects of that. Again, maybe you're not the one who's going to have the severe illness, but wouldn't you feel horrible if you passed it on to the person who does? And think about that. In the state of Maine, we have a population that is obese and therefore at high risk. We have the oldest population in the nation, so puts us at high risk. We have one of the highest cancer rates in the nation, putting us at high risk. And so all of those people are probably close to you in some fashion or another, and certainly out in our communities. So when you protect yourself, you're not only protecting yourself, you're protecting everyone else. Think about that as being the community watch or whatever it is that you're doing right now to keep your community safe. This is something that's even more important than that, because we just crossed a major threshold. 800,000 Americans have died from this disease. That is a staggering number. If we talked about this was a war, we'd all be saying the war needs to end. If we were talking about this being some other health condition, we would be saying where are the protests, where are the charity events, where are all the things to put that at stop? Well, we have all of those things. It's called vaccination.
Awesome. I'm going to combine this next question with one of my own. So, we're recognizing that just at the beginning, the introduction, I pointed out that we're reaching these new highs for hospitalizations, et cetera, all related to the Delta variant. And, we may be at the top end of that Delta surge at this point. We need a couple of more days to a week of data to really know if we are at that top end. But is our current surge expected to continue or get worse as the Omicron variant becomes more common? What do you think?
Unfortunately, I'm not sure if Maine is at its peak with Delta or not. It's difficult to say. We've continued to, see a couple of days where case counts have remained steady, and then all of a sudden we have another record high. And so I think we're still, if nothing else, plateaued, but may still be climbing. You throw Omicron in there, particularly with what it looks like to be more infectious, then I think, yes, we're in for a bad December and January that may linger on into the spring, much like we saw over the summer where Delta took over and all of a sudden we had high case counts and we never got back down to that. If you remember, in the beginning of June, we were talking about, hospitals that had 0 patients with COVID in it and that our case counts were exceedingly low. We have not had a breather since then. That really has not happened since the end of June, certainly since the end of the summer. And so if we have yet another variant that causes similar kind of infections, we're still talking about the same thing.
So my 8-ball says don't count on it. Thanks, Jim. Thanks for all that information. The next question is for Suzanne. The first 2 cases of Omicron in Hong Kong support airborne transmission, with one person having traveled from South Africa and the second person staying on the same floor of the Hong Kong hotel as the first person, but no known direct contact. Is this a problem for indoor gatherings for the rest of us during the holidays?
It depends. There's a lot that we still don't know about how that transmission occurred, or if they were we think they're related, but we're still not completely positive that they're related. Most respiratory illnesses do have an airborne component to it. So while they were on the same floor, we don't know how close in proximity they were. We don't know if one of them had some other type of respiratory illness and they were coughing down the hallway. In terms of staying safe for holiday gatherings or just in general outside of the holidays, it really is, if you're not sure of the people around you and where they've been, keep your distance as much as possible. If somebody's coughing, stay as far away from them as possible. And again, wear a mask. The mask will make a difference and will help.
I'll follow that up, Suzanne. That's very helpful. I mean, we really have to pay attention to the information as it's evolving and then process it. I think we saw on our slide 35 states have reported Omicron, and that's just since December 1st. I've thrown out a bunch of data that kind of shows it's really kind of catching fire. What do you think the likelihood that we have cases of Omicron in Maine today?
It would not surprise me one bit. We
Yeah,
just haven't
okay.
identified them yet.
Yeah.
But, you know,
So
at any
none of
time I
us
would-
should be surprised, when we find out we have a case or two or three.
Nope, not
Yep.
at all.
Okay, well, I think that's worth all of us considering going into, holiday plans.
Yeah, and Ed, remember that here in the state of Maine, but also across the entire United States, we don't do a good job in doing genomic testing. We just don't have the resources to do it, and particularly here in Maine. So the way Maine's program works, unless a provider has a specific request for genomic testing to be done, which typically doesn't happen because clinically we treat all the patients the same regardless of what variant they have, we rely on a system where states voluntarily send samples to the state of Maine, who then sends it out, a portion of the positive samples for genomic testing. They actually curtailed some of that because 99.9% of all of our genomic testing show that it was Delta. We've started to do a little bit more now to look for Omicron, and so it won't surprise me when we find our first case.
One of the resources that I personally use, and I reflected on that in our introduction once again, is what's going on over at the United Kingdom. And if we think about it historically, they had Alpha before us, they had Beta before us, they had Delta before us. What would be the conclusion about Omicron? So what's going on in Omicron, their prime minister is calling the coming tidal wave. So, that kind of influences what I'm thinking about what we're going to experience probably 2 to 4 weeks. There we go. 3.7 weeks. Okay. The next question is for you, Maya. Would a structured approach to wellness be a way for people to gain some control when many things seem out of control? And does a feeling of control help?
Yeah, control is something we talk about a lot in the counseling field, right? Is that we often, struggle to have some sense of control when there's so much uncertainty and so many things outside of our control. And I often invite people even to kind of get the swirling chaos that's happening in their mind, write it all down on paper, and maybe even doing so in a way that shows concentric circles of things within my very much within my locus of control, what I actually have control of, things in my sphere of influence, and then things outside of my control that I can still have feelings about, but I have to find ways to let those go because I can't do much about them. And really, when it comes down to it, what we can control is our own selves, right? And our own responses to things. And so having a systematic approach to wellness is within our own locus of control. We can create those routines, and routines are so helpful, particularly in winter when we know circadian rhythms can get kind of out of balance, and knowing, having the same time that we go to sleep every night, or at least lay down in bed every night, the same time that we turn screens off in order to do that, the same time that our alarm goes off every day, the same time that we schedule to go outside every day, eating foods around the same time, really, really helpful. And again, there's a lot we can't control, but there is those things we can, and it's incredibly helpful. So yes, I highly encourage people to figure out what they can control and then to make those healthy habits.
Excellent, thanks, Maya. I have a couple more for you.
Sure.
One is one of my own little techniques. I put things up against the so what test. If I do this or I don't do this, does it translate into so what? And it kind of really gives a sense of like really what's important. It's a way of setting priority. Do you really have to do this? I don't have much ambition today to get that done. So what, right? Okay. These next two questions for you, Maya, actually come from our participants from our last session that we didn't get around to answering. How can burnout be avoided during COVID-19 isolation?
I wish I had a very easy, simple answer to that, Dr. Gilkey.
You should use Dr. Jarvis's crystal ball.
Oh, it is hard out there, particularly among our healthcare workers, but in lots of different sectors, we are seeing people really just feeling at the end of their ability to just cope with the somewhat chronic nature of these stressors, and the inability to have access to the same kind of valves that maybe we had access to pre-pandemic, right? And so, you know, I am a big fan of having perfect not be the enemy of good, right? To finding, you know, what was it that I really loved about connecting with my roller derby team? Well, yeah, I loved, let's see, the physical nature of it. I loved getting exercise. Okay, so what's another way I can keep movement in my life, right? I can't do necessarily roller derby right now, but I can find another way to move. You know what else I really loved about it? I loved connecting with that group of women. Well, I can't go out there in the rink with them right now, but we can find a way to have a virtual gathering once a week, you know, just a half an hour or so, where we each kind of talk about the highlights and lowlights of our week. Because we did that in a less structured way when we were just jostling around in the derby. So again, I invite people to say, okay, that thing that I really miss and love that helped me cope with the stressors so I could continue to show up for work and do the things I love to do. How do I find what was really meaningful for me about that and recreate that in as well of a way as possible? It's not going to be perfect. It's not going to be the same. And still, we can be creative and find ways to have those needs met. And then, you know, I guess I would also say, reach out and get some support, right? We don't have to navigate this alone. And it's very normal to be feeling abnormal right now. It's okay. And, you know, there's never been a better time to acknowledge that that support is out there. It's helpful. People like me and many others in the helping profession are available and willing to help people find ways to strategize coping strategies.
Yeah, so burnout is such a big issue, and I think there's different gradations of burnout, you know, and we all think about, you know, our nursing staff, our healthcare workers at the front line with burnout. You know, the answer there may be different than, you know, if I'm just working from home, feeling isolated. You know, I have burnout too, but it may be a different level, may require different interventions. I think a common thread I've heard is focus on self-care. Yeah. Hey,
So
yes,
self-care so incredibly important. And I would like to put out there like self-care snacking, right? It doesn't have to be like this big thing that we do. It's like the littlest things. You know, if we can incorporate little things every day, just snack on the goodness. It may really help us get through these tough winter months ahead.
So here's a follow-up question from actually our last session as well. Talk more about managers serving as an example of self-care for employers. You know, sometimes leaders, part of what they do is they tough it out, you know, no matter what, you know, I'm going to make it happen. But here, sort of being vulnerable, being the manager focused on self-care, that's kind of a different hat to wear a bit.
Yeah, you know, it's if you look at the most highly functional teams, organizational development research has shown us that those teams that really perform at their optimal level have a high degree of psychological safety, where people feel like they can be vulnerable, where they can admit mistakes, they can ask questions, maybe even offer a dissenting view, but often just say, you know what, I'm not doing well, or I don't know how to do this thing, or I need some help, right? And setting that kind of a culture for a team really does require leaders that are able to do that. So yes, leaders want to have some, you know, professional, rational detachment at times in order to get the work done and hold everything leaders need to hold. And there are moments and times where it's really essential to model that kind of vulnerability. I remember one of my first professional jobs, I really looked up to the mentor, this woman who was just seemed to always have it all together, doing it all with grace. And, every day I asked her and I said, good morning, how are you? And she'd say, oh, I'm well, thanks. We'd continue on. And one day I said, good morning, how are you? And she said, I'm not well. And it just stopped me in my tracks. And I said, oh yeah. And she said, yeah, I had a really hard time sleeping last night and I'm more tired today than usual. And just that allowed me to think, oh, she's human and I can be human too, right? This is a safe space for me to do that. So I encourage people to, when appropriate, be vulnerable, share, and then share what you're doing about it. She said, I'm going to take it easy today and I'm going to get to bed early tonight.
I had a staff member yesterday contact me and was interested in information on getting a vaccination relative to family gatherings for, a member of his family, and what's the timing of everything to make it safe. So he started off by asking me, how are you doing? And I said, I'm not really doing so great today. I've been doing a lot of research on Omicron, and it's got me concerned. That's how it translated for me. But we talked about that a little bit. We talked about how he was feeling, and then we were able to get to the matter at hand, So yeah, I think that works, and it allows us to be human about it all. So great. Suzanne, I have a couple questions for you. Is the current testing at Northern Light Health identifying what strain is causing the active disease?
Not necessarily. In fact, we send some out, as Dr. Jarvis mentioned, we do send some out for genome sequencing, but we generally do not. And likely if it's sent out, it's an anonymous sample, so we don't hear back specifically as to which person it is. We treat every patient that's COVID positive very similarly, so there's not necessarily a reason to know the exact strain. That said, we are starting to send more samples out so that we have an idea of what variants we're looking at right now.
Great, thanks. Here's also a question that actually we had from last session, and I'll give you a shot at answering this. Socializing is an integral part of public housing. I'm looking for information to share with low-income tenants that say, I don't want to live in fear, and why can't we gather in community rooms? That's a tough question.
It is. And it really has to do with the fact that individual household units have their own different risk factors. When you start to have community gatherings of these different pockets of families from these different household groups, you're introducing risks to the much larger community as well. So it's really for the safety that some of these community spaces are still kind of off limits at the moment until we have a much greater idea of what the spread looks like, if we know what people's vaccination statuses are. If it's a mixed group of some people being vaccinated and some not being vaccinated, the risk is much greater in those circumstances, and in these community areas that it becomes difficult to manage.
Yeah, I have another one for you. This one actually might be on a lot of people's mind. It's actually a series of quick questions. I think it would be nice to hold a holiday party with food for my employees and their young families, especially since last year was a no-go. Am I putting people at risk? Do I open my company up to risk if people get the virus? How do I think this through?
Those are all great questions. And quite honestly, if you open up a office to a group with families, you really have to know what if people's vaccination statuses are. We've actually at Northern Light have said that we can't have mixed groups at any gathering, particularly if you have food or anything else. Yeah, it does put an organization at risk or a small business at risk. If there's a transmission of COVID within these interactions, are you even able to operate your business if you had people out because they now have to be isolated or quarantined?
Yeah, this is the hard stuff, really. Particularly being an owner of a business, a manager, making decisions. You want everybody to have some fun. We really want to engage with people. I'll tell you, I was put in that position with part of our staff where they wanted to have a holiday party, which we had last year's holiday party in July, and it was lots of fun. Everybody in the same room, doing our thing. And here we find ourselves in a bit different circumstance, And so what we are going to do after they put in the preliminary work about a month and a half ago, leading up to an in-person, including food, it was going to be a lot of fun. We're doing a virtual 1.5 hours tomorrow. So yeah, probably not as much fun, but it's going to be great to be with people, and people organizing it put a lot of effort into different fun things, so it'll be fine. So anyway, let me see. I have another question here for Dr. Jarvis. Breakthrough infections are more in the news lately. Is this something to be concerned about? Does it mean the vaccines and boosters aren't working?
Yes, I'll tackle the latter part first. It does not mean that vaccines aren't working. As we've talked about for a very long time, human beings tend not to get lifelong immunity towards coronaviruses. It's the reason why we get colds over and over and over again throughout our lifetime. And so the fact that we have waning immunity for people who received the Pfizer vaccine or the Moderna vaccine more than 6 months ago, or even the Johnson & Johnson vaccine more than 2 months ago, is not surprising to us that have been dealing with these kind of things for a long time. We expected that we would need to do some kind of seasonal vaccination process at the very least, and most likely would need to do boosters quite frequently at the worst. And so this is really kind of what we anticipated. But we can see from the graphic that I showed before, still vaccinated individuals still get a significant amount of protection over people who were unvaccinated, or even individuals who had previously been infected with the coronavirus that causes COVID-19. Cause for concern, I think the cause for concern there is just a reminder to us that this virus will evolve and find a way to continue to devastate us if we don't get it in check. And vaccination is the way that we get it in check. Avoiding vaccination is the way that we just keep letting it do the thing that it wants to do. And it's just another plea for people who have been vaccinated and fit the category of 6 months for Moderna or Pfizer, or 2 months for Johnson & Johnson, to get their booster shot so they keep their immunity level up. That's what we're seeing is protection against Omicron. And if that turns out to be true, it's even more important now that we all be vaccinated and get our booster shots when booster shots are recommended.
So get our vaccinations, get our boosters.
Stay home when you're sick, wear a mask, wash your hands. Had to throw that in there too.
Perfect. Suzanne's loving that. Well, unfortunately, we don't have time for another one. We could keep going. Okay, well, we have included some excellent tools for you at the end of this presentation. Thank you all for joining us, and thank you to our panelists. I hope this hour has been a help to support you, your employees, and our communities to safely manage through this pandemic. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be on January 13th. We'll be discussing the latest on COVID-19, strategies to enhance mental health, promotion of self-care for in-person and remote employees. We will send you the link for this session. We encourage you to share the invitation with your friends and colleagues. By working together to promote good health, we will be promoting good business. Thank you. Have safe and happy holidays.